Hello and welcome to Straight Talk. I'm Ayşe Süberker. Nearly 1 in 5 people in the world are locked down in their homes because of the coronavirus pandemic. Entire economies have come to a halt as public gatherings are banned and businesses closed. Turkey, which was one of the last major countries to report its first case, has seen a steady rise of infections and deaths. But that late arrival bought Turkey some much-needed time to learn what other countries have done both right and wrong in their battle against the coronavirus. After canceling most international flights and shutting schools and other non-essential businesses, daily life is coming to a standstill in many Turkish cities. Those measures came during the crucial early stages of the outbreak, steps that many countries in the EU failed to take. Countries like Spain and Italy, both which have surpassed China in coronavirus deaths, are now seeing their healthcare systems overwhelmed. Are there lessons Turkey can learn from what is happening in Italy, and what will European countries need to do to contain the coronavirus? And to break that all down, I'm joined by Dr. Silvia Bignamini from Monza in northern Italy, the epicenter of the nation's outbreak. From Ankara, we have Dr. Nur Baran Aksakal, a public health professor at the Gazi University Faculty of Medicine. And from Istanbul, Umit Ozlale, who is a professor of economics and department head at Ozyegin University. I want to welcome you all to Straight Talk. Thank you for joining me. We usually invite our guests on set, but because of these difficult times, we're trying our best to practice social distancing. Silvia, I want to start with you. You unfortunately conducted the first coronavirus test in your nursing home, and also you got it. And if I'm not mistaken, you're living and working in isolation at home. How are you? How are you dealing with the virus so far?
Yes, thank you. I'm still isolated at home. I feel better. I would say the disease is gone. I had pneumonia, interstitial pneumonia, but I was able to be treated at home. But unfortunately, after 3 weeks from the first positive test, I still tested positive for coronavirus yesterday. Oh. So I need to stay another week isolated and do the test again in 1 week. I have occasionally, I have some cough, and maybe, I guess, until all the symptoms are gone, the test remain positive, which means in theory that you can transmit to others. So I need to stay isolated again. When I meet others in my house, I wear a surgical mask, and if I touch something in the house, I need to use gloves, because it seems the transmission is through hair, but also and maybe mainly through contact. Mm-hmm. So the direct contact and indirect through the surfaces or other things that might be contaminated with your droplets.
How are you dealing with psychologically?
I'm working because I feel quite okay. So I work majority of the day. Also because of my role in the hospital and in the nursing home, I'm the health director. So part of my work is coordination. So I can do it from home, talking with my colleagues, with the other health workers, and organizing staff and procedures with them, and talking with the institutions. And then I try also to share my experience, since I also have a little bit more time than my colleagues in the hospital in the front line, to share my experience with the other part of Italy or Europe, or even with you, with the rest of the world, in case something can be useful to learn.
Yes, you're keeping yourself busy, which is good. Tell us about the latest situation in Italy, across Italy, and especially in Bergamo. Do you believe Italy has reached its peak, or it is yet to come?
The situation is in Italy is very jeopardized. So the situation we have in Bergamo, where I work, where my hospital San Francesco is very different from a situation in another region of the country. So what we are living in Lombardia, in the north, and in Veneto, the two northern regions, is very different from the center and the south of Italy. For Bergamo province, I hope that we have reached the peak, although you cannot say looking at numbers, also because the number of cases depends on the number of people you are testing. So the testing strategy influence your numbers. And now we do the test to the people that are in need of hospital care and are so symptomatics in need of hospital care. But this number is different from one day to another. And so the positivity rate that you find is a different denominator. So it's difficult to say today is more than yesterday because these numbers need proper interpretation. But what I can say, the hospitals are still full of people. My hospital, we don't have ICU, intensive care unit. We have a sub-intensive care unit. We have created it because of the virus. And we know all intensive care units beds in my region in Lombardia are full.
Yes.
So when you need to transfer somebody, the waiting time can be quite long.
Yeah.
And you need to manage the patient there until they are able to transfer the patient.
Yes. So we know that Italy's health system has been overwhelmed. I want to go to Ankara, to Nur. Nur, as we've mentioned, Turkey was one of the last countries to report its first case, but now the number of cases are steadily rising, unfortunately. Tell us about how the health system functioning so far.
Yes, hi. First of all, I would like to remind that the first case was on March 11 in Turkey, and now we have 75 deaths and more than 3,000 cases, 3,600 cases. And since the beginning of the crisis, even before the beginning of the crisis, the Ministry of Health has gathered a scientific committee in Turkey.
Yes.
And it has started with the cancellation of the flights from the country to and from the countries where the cases were seen. And then a very quick response to close the schools was taken, and then the legislations for easing the civil servants to work remotely, and thermal cameras to airports and borders has been placed. But the most effective thing that should be carried out was to quarantinize and isolate the individuals who come from the countries that the cases are seen, including the UMRA.
What is your take on Turkish people's reaction to those restrictions? Because despite stern warnings, we still see people walking on the streets. What is your take on that?
Yeah, the latest decision was for curfew for the individuals who are 65 years old and older, and the ones with the chronic diseases. The most important risk group was this, and all the restaurants and coffee shops and other places were shut down. But still, we see that many people are reluctant with all these precautions because they really, I don't know why, but they really don't understand. This is a situation that only be get rid of keeping the social distance and hand hygiene and understanding the symptoms of the disease.
Yeah, but at the same time, if I'm not mistaken, we need to get young people off the streets. So let's go to Istanbul. Umit is waiting for us. Long before it was declared a global pandemic, the global economy has suffered tremendously, and now with no clear light at the end of the tunnel, give us an overall picture of the world economy.
Yeah, I mean, as you said, the financial markets were already very fragile right before the outbreak of the virus. and the virus triggers, but the crisis that we are having right now is much larger than we expected. But I mean, if you wish, we can start with a reminder. We have to remind ourselves that the first goal of economics is not basically the financial markets, the stock exchange markets, or the exchange rate, but to ensure the well-being of the people and the society as a whole. So, I mean, there's a large literature that focuses on the effectiveness of health policy, quantifying the life quality of the society, resilience of the economic systems. And now the world economy, once again, has witnessed that these are very important things. I mean, apart from the well-being of the financial markets, the operation of the exchange rate markets, we have to remind ourselves that economics and all of the other sciences are basically related to the well-being of the individuals and the society. And now we have seen that the countries diverge to an important extent while fighting, with the adverse effects of crisis. And I mean, if you let me, I would just, like to summarize the current situation and how it is different than the previous ones that we had. I mean, I can easily summarize the current situation as, once in a lifetime crisis. Yes. For the, older people who have seen the oil crisis in 1970s, it was basically a supply shock, but this time it is a supply shock which is much deeper than the oil crisis of 1970s.
Yes.
The production almost stopped. It is not likely to recover in the near future. And the sharp decrease in the production, led to several negative outcomes. And
okay.
I would like to talk about these things. And first of all, now, since the production has stopped, the cash flows and the expected profits of the corporations were hit badly. And that resulted with an increase in the bankruptcy risks of the corporations. That makes it very different than the previous financial crisis, by the way. I mean, I'm pretty much sure that, you had a lot of, coverage during the 2008 financial crisis and the reasons that triggered the previous financial crisis. Yes. The previous ones that we had basically originated from fragile financial markets, especially the subprime mortgage markets, the latest one. But I mean, this one, the coronavirus crisis, originated from the very real side of the economy. And the health policies or the well-being of the societies is at the very core of this problem. So this is exactly the reason why this crisis is dramatically different than the previous
ones. And we also see the international community's failure in combating this outbreak, especially when we take a look at the European Union. We see a deep rift between the EU member states. Silvia, I want to continue with you. The Italian government has criticized the European Union and other member countries in their slow response to send aid to the country and to heed the warning signs. Can you touch on some of these failures?
Yes, I think especially in this moment is not a time for criticisms, it's time for union. So I want to see what is happening now. We are receiving aid, not only from Europe, we are receiving aid from China, Russia, and Cuba. They sent doctors, equipment for us, and we feel we are not alone. There is a big movement from all over the world to help us, to help Italy, and I'm really thankful for that. Of course, there are some measures that maybe if they were taken before, the situation could have been different, but it is easy to say after. So Italy decided to have the lockdown on the 11th of March for the entire country. And this, I think, has been good for the rest of Italy. For us in Bergamo, as other few cities, maybe it was too late, but we need to assume that sometimes you need to see something happening, something very bad, to be able then to strongly take some decisions.
Yeah.
Even for the rest of the population, I was hearing Ankara, the people are still going into the streets. But of course, I also understand in the beginning, myself and also others were thinking this is just a flu. You realize it's not a flu. Is really giving pneumonia, lung disease, and can be really dangerous, not only for elderly people. We have in Bergamo people of 40 or 50 years old, almost my age, between 40 and 50 years old, that are in intensive care units very seriously. So, but this is something that unfortunately, when you realize it, it is because you are living it, or you see people around you living it, and then it's too late for action. So in this moment, you need to trust what happened to others, and behave properly, just trusting on what happened to us.
Yeah, it's ironic that it is Cuba, Russia, and China rushing to the aid of Italy instead of their European Union partners. But Silvia says it is time for unity. So on Turkey's side, President Erdogan gave an optimistic prediction, saying that Turkey will overcome this outbreak within 2 to 3 weeks. Let's take a look at Turkey's health sector workforce. Turkey has 165,000 doctors, 205,000 nurses, 490,000 medical officials, 360,000 support staff. And as for Turkey's medical equipment stockpile, it has 2 million coronavirus test kits, can produce 150 million masks per year, and Turkish tech company Biosys said it'll produce 500 ventilators. So, Nur, despite the readiness, is there a risk of the health system being overwhelmed in the weeks to come?
Yeah, Turkey has a good potential, I agree. But I also know that this is an extraordinary situation, and the numbers may not count when you face the situation and when you have the peak very high in a population with 80 million. So what now is needed to be done is a better organized workforce, and the role of the field staff is very critical, because not only preparing the hospitals that we have done it, we have selected the pandemic hospitals, we have trained the personnel, we have the personnel at place. But in the first round, what will happen to the workforce if you don't stop individuals to attend hospitals in a very high number? So what Turkey has to do is working with the field staff to find cases and really a better isolation, because the staff will be, the harmony is very much needed between the field and the health services in the hospitals and in other premises. Because when the other countries teaches a lot,
yes,
and we see their experiences. Of course, we have enough capacity now, but we don't know if the capacity is overwhelmed. And this is a risk in front of Turkey. It hasn't passed yet. And I believe that by the middle of maybe April, we will see the peak. But the numbers really makes us think that we really need to work with the provincial coordination units,
yes,
and have a better understanding of finding the cases and telling the individuals the risk. And this risk is still going on and the numbers are increasing. And the only way to be safe and to be healthy is staying at home and not overwhelming the capacity of the hospitals and the healthcare workers. So none of the countries has a battle with these only. The only battle is now in the field, and make people understand that please stay home and please obey to hand hygiene. Please be understandable and do not admit to the hospitals and the healthcare settings.
Yeah, but in order people to stay at home, the state has to give some guarantees for people with lower incomes. Many countries we know that have announced economic stimulus packages to combat the job loss and better the economy. Turkey has also announced a package. Let's go through its details. This package will embark 7 billion Turkish liras or $1 billion to minimum wage workers. It'll increase the minimum pension to $233, and a monthly allowance will be given to 2 million low-income families. So, Umit, is this a first good step and we'll be needing more stimulus packages?
To start with, it's a good step. But I mean, I would expect the relief package to be more inclusive, to be honest, and to target SMEs, small and medium enterprises more. And we should also, take more generous steps towards the most disadvantageous groups that will be negatively affected by this, virus crisis. Now, I mean, we haven't seen the most negative effects basically on the labor market up to now. There will be a huge unemployment, not just on local scale, not on Turkish scale, but on a global scale, right? So at that point, I mean, think about the job market, think about the people who are facing risks of being unemployed. So there will be need for definitely new relief packages, which will definitely ensure the people on the labor force not to lose their jobs. For the ones who lost their jobs, we should offer very generous packages because, to start with, it's not their fault. It's not the fault of the individuals, the workers, the small and medium enterprises. It's basically an exogenous shock that hits the globe, and we have to take, more generous steps towards dealing with the crisis. Now, remember, now we haven't seen...
Very shortly, Umit, I'm running out of time. How do you think this outbreak will affect Turkish economy since it has a great trade volume with the European Union countries?
Well, definitely it will not affect. It will have a very negative effect. For example, our major trade partner, Germany, and other, trade partners like Italy, Spain, UK, they will definitely have very low economic growth rates. And the European Union was also on a very fragile path before the crisis broke down. But now we are talking about Italy, Spain, Germany, which is likely to have negative growth rates. There will be less demand in this continent, which will definitely affect our exports. And you remember that our exports, industrial exports, and also the tourism revenues were a major force, a very positive factor to have a solid balance of payments for Turkey. There will be unemployment, increasing unemployment, so we definitely have to run unpleasant budget deficits in the future.
All right. On the other hand, G20 leaders got together and pledged commitment to presenting a united front against this outbreak, and they're going to inject $5 billion into global economy. But we'll see whether it will be enough or not. On the other hand, UN Secretary General Antonio Guterres recently released a stern warning on his Twitter account. He said, "We are at war with a virus and not winning it. It took the world 3 months to reach 100,000 confirmed cases. The next 100,000 happened in just 12 days. Third took 4 days, the fourth 1.5 days. This war needs a wartime plan to fight it." Silvia, what would you suggest to both Turkish citizens and Turkish health workers, as well as international health workers? What are the lessons to be drawn from your experience?
In my experience, we learned, especially in Bergamo, now we say we are all positive. We have to behave thinking that we all have the virus. So especially health workers, we can be a vector of the virus in healthcare facilities where there are people, elderly people or people with other diseases. So we need to behave using all the protective equipment, the gloves, the masks, as if not only we don't want to get the virus, but we don't want to transmit the virus. Even if we don't know, we are not tested, but in an environment where the virus spread all over, we should assume that we are at risk of having taken the virus, and we need to take all precaution not to transmit it to others. So the same is for the general population, the people. you think I feel okay, but I know a number of people that with the virus are asymptomatic or with mild, light symptoms, but still you can transmit it to others.
Yes.
So you have to be conscious and responsible every time, all the time. And the rule is no contacts, no touch, no face-to-face. Use other innovative technology means for social contacts in this moment. And if you feel not good, if you feel you have fever, stay at home.
Okay.
Don't take a tablet and go out. Stay at home.
Okay. Silvia, thank you very much. I hope you'll get well as soon as possible. We'll be responsible and stay at home as much as we can. Nur, thank you for joining us from Ankara. And Umit, thank you for joining us from Istanbul. Appreciate it a lot. And that's all for this edition of Straight Talk with me, Ayşe Süberker. If you've got any comments, do share them with us on Twitter with the hashtag Straight Talk. Also, don't forget to subscribe to our YouTube channel. Until next time, take care and goodbye.